The topic of today's lecture is cholinergic antagonists, and the cholinergic antagonists are divided into two groups on the same way as the cholinergic agonist. So it is the muscarinic and nicotinic blocking agents. And muscarinic blocking agents mostly inhibit the parasympathetic system, and nicotinic blocking agents will block the ganglia, both sympathetic and parasympathetic, and also the neuromuscular junction. For this reason, the uh, the ganglionic blocking agents are not clinically useful, and we will not discuss them today. And the neuromuscular blocking agents are also discussed. We will discuss them later because they have also limited clinical effectiveness. So today we will mostly focus on the muscarinic blocking agents because their clinical usefulness, and there are 5 types of the muscarinic receptors that are classified to M1, 2, 3, 4, and 5. These 5 types are distributed differently. For example, M1 subtype is mostly in the central nervous system, and also in the end of the sympathetic nerve, and M2 is in the heart, and M3 is mostly on the effector organ cells, and M4 and 5 are only found in the central nervous system and are absent in the peripheral nervous system. So mostly today we will talk about the M1, 2, and 3. So these are most common in the peripheral nervous system, and most of the anti-muscarinic drugs will act on M1 and 2 and 3 subtype of the muscarinic receptors. And the anti-muscarinic drugs are well known for thousands of years, and they have been used as medicines, poisons, and most well known is the atropine. Atropine has been used as in medicine, cosmetology, and also as a poison. And the chemical structure of the atropine is alkaloid, as well as many of the substances that are derived from the plants. So a minute. So the chemical structure of the atropine is so it's amine alkaloid, and it chemically atropine is a ester of the tropic acid. So this is a tropic acid, and this is a steric bond, and this is a base. The base is the tertiary amine, so this is tertiary amine, and the structure is alkaloid, and it is found in Atropa belladonna. Hope you remember the plant from my botany class. And the second name for the Atropa belladonna is deadly nightshade. So the name is very beautiful, so it's nightshade and it's deadly, like most women. So, and also the second type of the alkaloid that is also known very well is the scopolamine, and scopolamine has additional oxygen here. So the chemical structure of the scopolamine is the same as for atropine, but the additional oxygen here, and scopolamine is obtained from the Hyosamus niger, and also has a common features with the atropine, and is also used as a drug. So scopolamine mostly acts on the central nervous system, and is used from the motion sickness. And scopolamine is a stereoisomer, and the atropine is also stereoisomer, and usually they are found in the stomachs. So commercially available atropine is usually a mixture of the isomers, and the isomers have different potency. So the left isomer is more potent than the right isomer. So and there are also many synthetic molecules that have anti-muscarinic effects, and these are the examples of the synthetic anti-muscarinic drugs, and mostly they act on the central nervous system or the eye. And some of the antihistaminic, antipsychotic, and antidepressant drugs have similar chemical structure, like, for example, benztropine has a similar structure for the benzodiazepines, and that is why these classes, antidepressants, antihistamines, have some anti-muscarinic effect. So And also the quaternary amines uh, have less central nervous system uh, effects, and they have been developed to reduce peripheral effects and to reduce the adverse effects for the central nervous system, like for example tiotropium. And tiotropium is used for the treatment of the asthma. Also, some of the anti-muscarinic drugs are used for the treatment of the Parkinson's disease, and benzodiazepine is the first of these drugs. And benzodiazepine is also a tertiary amine and used for the treatment of the Parkinson's disease, that is a central nervous system disease. We will discuss this disease later in the course, as well as the asthma and treatment of the asthma. So the alkaloids are well absorbed from the GI, and they can also be absorbed through the eye, and they can also be absorbed through the skin. That is why, for example, scopolamine is used as a transdermal patch. And for the so this is for the natural muscles. And quaternary amines are absorbed poorly. For example, tiotropium is not absorbed much at all, and this difference is very important. And atropine and other tertiary amines are distributed completely, and they enter the central nervous system, and that is why the action on central nervous system will limit the maximal therapeutic dose, and the fastest drug that enters the central nervous system is scopolamine, and it is rapidly distributed in the central nervous system, and that is why it's used for the motion sickness. Quaternary derivatives, like for example benzodiazepine, are taken by the central nervous system slower, and that is why they are safe, and there are less central nervous system side effects. The atropine is eliminated in two phases. So first is the rapid phase, and second is slow phase. So the elimination is by the kidneys, and half of the atropine is eliminated unchanged, and another part is hydrolyzed and goes conjugation, and that is why the effect declines rapidly, uh, but uh, but the exception is the eye, because there is no metabolism in the eye, and that is why the effect on the iris and ciliary muscle will last for 72 hours. So as atropine is mostly used in the ophthalmology, that is why the action of atropine is 3 days for the eye. For the other body, like when taken orally, the action will last 12 hours. The mechanism of action of atropine is based on the blocking the cholinergic actions, and even a small dose of atropine can overcome the large concentration of the acetylcholine, and the atropine has a high affinity for the muscarinic receptor, and the binding to the receptor prevents the release of the inositol 3-phosphate, and that prevents the inhibition of the adenylate cyclase, and so this will increase the cyclic adenosine monophosphate. So and muscarinic blocking drugs are inverse agonists, and the inverse agonists include the atropine, benzodiazepine, dihexyphenidal, ipratropium, and the glycopyrrolate. So and also scopolamine. The effectiveness of anti-muscarinic drugs varies with the TCO and the agonist. So TCS that are mostly sensitive for the atropine are salivary, bronchial, and sweat. So the secretion by the parietal cells of the GI is less sensitive, and atropine is highly selective for the muscarinic receptors, and the atropine is not selective against the types of the receptors like M1, 2, and 3, and that is why it stimulates all of receptors, and sorry, it blocks all the receptors, and other anti-muscarinic drugs are more selective, and and of the quaternary amine anti-muscarinic agents have ganglionic blocking action. So and others can also block the histamine receptors, and the selectivity of muscarinic receptor subtypes has not yet been defined, and the effect of the atropine to the central nervous system uh, is minimal, and that is why atropine is has a sedative effect on the brain, and scopolamine has a more prominent effect for the central nervous system and will lead to the drowsiness and also amnesia in some patients. In toxic doses, scopolamine can lead to the excitement, agitation, hallucinations, and coma, and subsequently the death. Uh, and The atropine can reduce the tremor caused by Parkinson's disease, and it has been the first drug used for the treatment of the Parkinson's disease, uh, as the extract of the belladonna, and the tremor from in Parkinson patients is related to the excessive cholinergic activity in the central nervous system, uh, because of the deficiency of the dopaminergic activity that usually inhibits the basal ganglia striatum system, and the combination of the anti-muscarinic agent with the dopamine receptor drug, that is usually levodopa, is more effective treatment than the monotherapy for the Parkinson's disease. And the muscarinic transmission also leads to the vestibular disturbances, like during the motion sickness, and scopolamine is most of the effective drug in preventing these disturbances. So the action of atropine on eye is based on the constrictor of the uh, pupillary muscle, and this activation is blocked by the topical atropine and results in the mydriasis, so that is increase in the eye, in the size of the pupil. So the mydriasis is considered cosmetically desirable during the Renaissance, and it gives the name for the belladonna because uh, from Italian, bella means beautiful and donna means woman. So belladonna is translated as a beautiful woman. Uh, because it's used as an extract uh, to uh, to apply for the eye as eye drops, and that increases the beauty of the woman for about several days. So this is the action on the pupil. But the second important ocular effect is cycloplegia, because of the contraction of the ciliary muscle, and cycloplegia results in loss of ability to accommodate. So this red one is the loss of the accommodation, and eye cannot focus for near vision. That is why most beautiful women during the Renaissance were blind. So they were beautiful but blind for about 10 days. So for about 1 week at least. So as you can see, the pupil, so both mydriasis and cycloplegia are still used in ophthalmology, but the action on pupil is shorter, and that is why if women want to be beautiful all the time, she have to reapply the drug after about 6 days, and that is why accommodation actually lasts about the same time but a little bit longer. And that is why women who were beautiful women during their Renaissance were continuously blind. So atropine still can be used in the ophthalmology, but it can precipitate glaucoma in patients with a narrow angle chamber glaucoma, and that is why it should be used with caution. And the third effect is the reduce in the lacrimal secretion. That is why patients have adverse effect, that is sandy eyes, especially with the large doses of the atropine. So the next action is the cardiovascular system, and our cardiovascular system is very sensitive for the muscarinic receptor blocking, and therapeutic doses of the atropine lead to the tachycardia, and because the vagal stimulation is blocked, and lower doses result in bradycardia, and that is because the action, so that is because of the block of the peripheral M1 receptors, and this limits the release of the acetylcholine in the sinoatrial node, that is the pacemaker of the heart. And in toxic concentrations, the atropine will lead to the blocking of the conduction, and leads to the local anesthetic action. Most of the blood vessels receive no direct innervation from the parasympathetic system, and That is why atropine will not act much on the blood pressure. Uh, but there are exceptions, like the coronary arteries and also the sympathetic cholinergic nerves that lead to the vasodilation in the skeletal muscles, uh, uh, in the vessels that will lead to the skeletal muscle, and atropine can block this vasodilation. Uh, and also all vessels contain muscarinic receptors that mediate vasodilation, but they are not blocked by the atropine or other muscarinic drugs because there is no any acting agent on that. And at toxic doses, atropine lead to the cutaneous vasodilation, especially in the upper portion of the body. The mechanism of that is not known yet. The net cardiovascular effect of atropine uh, uh, leads to the tachycardia, but there is little or no effect on blood pressure. And the atropine blocks the action of the muscarinic agonist for the heart. Action on the respiratory system is based on the act on the smooth muscles and the secretory glands. Both of them have a vagal innervation and have muscarinic receptors, and administration of atropine leads to the bronchodilation and reducing the secretion of the secretory glands. That is why the antimuscarinic drugs are used for the treatment of the asthmatic patients, and also for the patients with the chronic obstructive pulmonary disease or COPD. And sometimes antimuscarinic drugs are used before the administration of the inhalant anesthetics to reduce the secretion in the trachea and the possibility of the laryngospasm. In the GI system, the blockade of the muscarinic receptors has a dramatic effect on motility and secretory functions. Anti-muscarinic drugs also reduce the salivary secretion, and that lead to the dry mouth. That is common adverse effects. And the gastric secretion is blocked less effectively. About the amount of the hydrochloric acid secretion and pepsin secretion is reduced. And benzene is more potent analog uh, and can reduce, as well as clonazepam, and they can reduce the gastric acid secretion with less adverse effects than atropine because they are more selective. The Perazepam and the Cholinoceptor are selective M1 receptor blockers, and these muscarinic receptors M1 are located in the vagal ganglion that innervates the stomach, and so if you look here, the Perazepam has a higher affinity. So Perazepam has a higher affinity for M1 and M2 and M3. And so it's supposed that Perazepam mostly acts on the M1 that are responsible for the regulation of the gastric acid, but further investigations lead to that in animals M3 also lead to the stimulation of the secretion of the acid. So that is why Perazepam is acting on all, but is on M1 and M3 receptors, but has a higher affinity blocking for the M1 and M3 than the atropine, and that is why it's more effective as an anti-acid secretion drug. The GI smooth muscles is affected completely, and both stomach and intestine motility is reduced, and that prolongs the gastric emptying time, and that leads to diarrhea, so that stops the diarrhea, and so the but the effect of the drug will persist only for several days. So the anti-muscarinic drugs and atropine relaxes the smooth muscles of the uterus and bladder wall and slows voiding. This action is useful in the treatment of the spasm induced by inflammation, surgery, and neurologic conditions, but it can precipitate urinary retention in men who have prostatic hyperplasia. So the sweating glands also depressed blocked by the atropine, and because sympathetic cholinergic fibers innervate sweat glands, and the muscarinic receptors are blocked by the atropine, uh, and that leads to the elevation of the body temperature with the large doses. Uh, so, and that is called an atropine fever. And the muscarinic receptor blocking drugs have several uh, applications for the treatment of poisoning by the muscarinic agents like mushrooms, so those that are found in mushrooms, and also have several applications for treatment of the diseases like central nervous system diseases, and this is Parkinson's disease. Uh, and uh, uh, so the antimuscarinic drugs are used for the treatment of the Parkinson's disease, uh, like Vestropan, and they are usually combined with the levodopa. And second indication is motion sickness, and Scopolamine is one of the most commonly used drugs for the motion sickness. So it's also effective for the air disease, uh, and usually given by mouth, or in later days they invented the transdermal patch. The patch is more long acting, and duration of action is up to 3 days, and the scopolamine leads to the sedation and dry mouth. Most of the antimuscarinic drugs are used in ophthalmology, and the main indication is accurate measurement of the refractive error in some patients like children, and or uh, um, military uh, preparing men, and so this in these patients the atropine will lead to the ciliary paralysis, and that this facilitates the examination of the retina, uh, and also can the real refractive uh, uh, properties of the eye can be measured. So antimuscarinic agents applied topically as drops or ointments uh, for uh, for adults and children. The short-acting drugs are preferred. So usually uh, the cyclopentolide and tropicamide are used because of their short acting, uh, uh, and tropicamide is usually preferred as the most short acting, so the patients can find their way home themselves. So uh, In young children, sometimes the atropine is used because they don't need to eyes to return back to home. They can be carried by their parents. So the uh, the drug goes from the uh, conjunctival sac via the nasolacrimal duct into the nasopharynx and can be diminished by the use of the ointment form rather than the drops. Uh, the anti-muscarinic drugs should never be used for mydriasis unless cycloplegia or prolonged action is required. Alpha-adrenal receptor stimulant drugs like phenylephrine can produce short-acting mydriasis that is usually sufficient for fundoscopic examination. The second indication is to prevent the synephia in formation in uveitis and iritis, and in that case, long-lasting drugs like homotripine are used. For the respiratory disorders, the atropine is used as preoperative medication for some anesthetics to reduce the irritation of anesthetics because they usually increase the secretion and also lead to the laryngospasm. The anesthetic injection of atropine or scopolamine usually prevents these effects, and scopolamine also produces amnesia that is useful during the surgery and obstetric delivery. So this side effect is actually desirable, and but newer anesthetics are usually less irritating, and atropine is applied less frequently now. In some patients with a chronic obstructive pulmonary disease, the atropine and antimuscarinic drugs can be used for reducing the bronchoconstriction, especially in smokers, and ipratropium and tiotropium that are synthetic analogs of the atropine and are used as inhalation drugs in those patients. The aerosol route of administration has maximal concentration in the bronchial tissue, and there are almost no systemic side effects. Tiotropium has a longer bronchodilation action and can be given once daily, and its elimination half-life is 5 days. And tiotropium is reducing the incidence of the exacerbations in these patients, and is very useful as an adjunct therapy. So both drugs, ipratropium and tiotropium, are also used in the inhalation drugs in asthmatic patients. So I think that is all for today, and thank you for your attention, and see you next week.
Thank
See you,
you.
Zito.